The studies run by the German CLL Study Group are also focusing now in these times on the question, do we still need chemotherapy, or maybe can we treat or maybe even cure CLL by administering non-chemotherapy-containing combination therapies. For that purpose, in the elderly patients or patients with more comorbidity, we will just start recruiting in a randomized setting between chlorambucil plus obinutuzumab versus the non-chemotherapy combination ABT-199 or venetoclax plus obinutuzumab. Here we just finished a safety run-in phase where we treated 12 patients, 12 comorbid patients with this concomitant medication, and the treatment is well tolerated and it seems to be very active. So we are pretty much positive about this study. In Binet stage A patients, which usually do not require treatment, but we know that high risk or very high risk patients have a poor prognosis here as well. We are randomizing those patients between watch and wait, which is the standard, versus early treatment with ibrutinib. And this study will finish recruitment within the next 2 months. And what we see so far is that ibrutinib, as we know that from the studies in relapse setting, is also very well tolerated in Binet stage A patients with very high risk of disease. And finally, the study focusing on fit CLL patients, we will do here a cooperation with the HOVON group, the Nordic group and the SAC group in a very large study, because it's a 4-arm randomized study comparing our standard chemoimmunotherapy with FCR or BR versus non-chemotherapy-containing combinations, and they all contain also the venetoclax, ABT-199. We will have one arm with ABT-199 plus rituximab, one arm with ABT-199 plus obinutuzumab, and the third arm will contain a triple combination with ABT-199, obinutuzumab plus ibrutinib. And the aim of this study, especially with this very intense combination, is of course to not only obtain very long-lasting remissions, maybe even curing the patients, also for justifying the immense costs of this treatment regimen.